Good morning. I'm going to tackle the cellular. So the cellular components are the complex biomolecules and structures of which cells and thus living organisms are composed. So the examples include the macromolecules such as proteins and nucleic acids, biomolecular complexes such as ribosomes, and structures such as membranes and organelles. So the cell, from Latin cella, meaning small room, is the basic structural, functional, and biological unit of all known organisms. A cell is the smallest unit of life, and cells consist of cytoplasms enclosed with the membrane, which contains many biomolecules such as proteins and nucleic acid.
So, good afternoon, ma'am. So, I am Anisa Tarang. So, my report is about cervix uterine. So, what is cervix? So, the cervix or cervix uteri is the lower part of the uterus in the human female reproductive system. The cervix is usually 2 to 3 centimeter long and roughly cylindrical in shape, so which changes during pregnancy. So, the narrow central cervical canal runs along its entire length, so connecting the uterine cavity and the lumen of the vagina. The opening into the uterus is called internal os, and the opening into the vagina is called the external os. So the lower part of the cervix, known as the vaginal portions of the cervix, bulge into the top of the vagina. So the um, this cervix has been documented anatomically since at least the time of Hippocrates over 2,000 years ago. So, cervix function. So, yung cervix function, meron siyang three. So, the first is, nagproproduce siya ng cervical mucus during the most fertile phase of the menstrual cycle. Which is, na tumutulong din dito yung sperms travel from the vagina into the uterus. Then, the next is the opening during labor para ma-allow yung baby to pass to the birth canal. Then after that is yung cervix din is nagpo-protect din siya ng uterus from the bacteria and the other foreign object. Though here is how the cervix function during specific phases of the menstrual cycle and pregnancy. So dito is um, the first is during menstruation. So during menstruation, this cervix is open a small amount to permit the passage of the menstrual blood out of the uterus and through the vagina. While during conception naman, dito yung cervix, yung conception nag-occur siya when sperm travel through the cervix para maka-enter sa uterus and ultimately fertilize an egg. So around ovulations, the most fertile part of the menstrual cycle, um, your cervix is nagproproduce siya ng clear mucus, which is tumutulong din para yung sperm is ma-reach niya yung uterus. While during pregnancy and labor naman, during pregnancy, yung cervical mucus, nagtitiken siya para makakreate ng cervical plug that shield the growing embryo from infection. Then, when a woman gets closer to going into the labor, the cervical plug thin and it's expelled. So, yung cervix is nagsasoften siya and nagsashortens. Tinatawag siyang effacement. And then, nagdi-dilates din siya in preparation for birth. So, for the pregnancy and labor, as your due date nears, your healthcare provider will check the cervix for dilation para matry to gauge when you are likely to give birth. Then the last is during menopause. So, yung during menopause, yung hormonal changes and aging change ng nature of the cervical mucus and vaginal discharge. So as a result, some menopausal woman is nakaka-experience sila ng mga vaginal dryness. Next is where is the cervix? So, saan ba natin makikita yung cervix? So, this cervix is located between the uterus and the vagina. And also, it's possible to feel the cervix with your finger if you do so. So, you'll notice that it changes texture over the course of your cycle. So, in order to actually see your cervix, so you will need to use a mirror and bright light, but it may still be difficult to see based on the length of your vagina. So, there are three parts of the cervix. So, yung first part ng cervix is the lowest part, which can be seen from inside the vagina during a gynecological exam. Tinatawag siyang ectocervix. So the center of the ectocervix can open, creating a passage between the uterus and the vagina. So the next is the highest part in the endocervix. So tinatawag siyang endocervical canal. It's the passage between the ectocervix and the uterus. Then the third part of the cervix is the point in the middle where the endocervix and ectocervix meet. So it's called the transformation zone. So condition and problem of the cervix uterine. So first is the cervical cancer. So yung cervical cancer is a type of cancer that occurs in the cell of the cervix. So yung lower part ng uterus na nakakonect to the vagina. So yung mga various strains of the human papillomavirus or HPV, a sexually transmitted infection, play a role in causing most cervical cancer. So, types of cervical cancer, meron tayong dalawa. The type of cervical cancer that you have helped determine your prognosis and treatment. The main types of cervical cancer are, yung first is yung squamous cell carcinoma. So, yung squamous cell carcinoma, this type of cervical cancer begins in the teen. Flat cell siya or squamous cell na nakalining sa outer part of the cervix which project into the vagina. So, yung most cervical cancer are squamous cell carcinomas. So, the next is the adenocarcinoma. So, yung adenocarcinoma, these types of cervical cancer begin siya in the column shape. Glandular cell na nakaline sa cervical canal. So, we have symptoms of cervical cancer. So, early stage of cervical cancer generally produce no sign or symptoms. So, sign and symptoms of more advanced cervical cancer, naka-include dito yung vaginal bleeding after the intercourse between periods or after menopause. Then the next is the watery, the bloody vagina discharge that may be heavy and have a foul odor. So, last is the pelvic pain or pain during intercourse. Then, meron ding risk factor for cervical cancer, include dito yung many sexual partners. So, many sexual partners, early sexual activity, other sexually transmitted infection or the STIs, then a weakened immune system, smoking, exposure to discourage preventions to drug. So, meron ding how to prevent the surgical cancer. So first is ask your doctor about the HPV vaccine. Then next is the have routine pap test. Then practice safe sex. And the last is don't smoke. So, dito sa sa causes ng So dito sa prevention ng cervical cancer, first is ask your doctor about the HPV vaccine. So, receiving a vaccination to prevent HPV infection may reduce your risk of cervical cancer and other HPV-related cancers. So, ask your doctor whether an HPV vaccine is appropriate for you. Then, next is have routine pap test. So, pap test can detect precancerous conditions of the cervix. So, they can be monitored or treated in order to prevent cervical cancer. So, dito is most medical organizations suggest beginning routine pap tests at age of 21 and repeating them every few years. Then, practice safe sex. So, practice safe sex, nagre-reduce siya ng risk of cervical cancer by taking measure to prevent sexually transmitted infection, such as using condoms. So, every time you have sex and limited the number of sexual partner you have. Then, the last is don't smoke. So, if you don't smoke, don't start. If you do smoke, talk to your doctor about strategies to help you quit. So, sa risk factor for cervical cancer, include dito yung many sexual partners. So, yung many sexual partners, the greater your number of sexual partners and the greater your partner's number of sexual partners, sa early sexual activity naman, having sex at an early age, nag-i-increase siya ng risk of HPV. So, next is other sexually transmitted infection. So, having other STIs such as chlamydia, gonorrhea, syphilis, and HIV/AIDS is nag-i-increase siya ng risk of HPV. A weakened immune system. So, you may be more likely to develop cervical cancer if your immune system is weakened by another health condition and you have HPV. So, smoking. Smoking is associated with squamous cell cervical cancer. The last is exposure to miscarriage preventions of drugs. So, if your mother took a drug called diethylbestrol while pregnant in the 1950s, so you may have an increased risk of a certain types of cervical cancer called clear cell adenocarcinoma. So, the next problems of cervix uterine is this cervicitis. So, cervicitis is an inflammation of the cervix, the lower narrow end of the uterus, that opens into the vagina. So, possible symptoms of cervicitis include bleeding between menstrual period, pain with intercourse, or during a pelvic exam, and abnormal vaginal discharge. So, however, it also possible to have cervicitis and not experience any sign or symptoms. So, signs and symptoms of cervicitis. So, many women with cervicitis don't have any symptoms. The condition may be discovered only after a routine exam or test. So, signs and symptoms may include, first is grayish or pale yellow, the vaginal discharge, so abnormal vaginal bleeding such as bleeding after sex or between periods, pain during sex, difficult, painful, or frequent urination, pelvic or abdominal pain or fever in rare cases. So, risk factors for cervicitis. So, first, you may be a higher risk for cervicitis if you, first is, had recent sexual intercourse without a condom. So, recently had multiple sexual partner, have had cervicitis before. So, diagnosing cervicitis. So, if your doctor suspect you have cervicitis, they may do a pelvic exam. This let the doctor gets a closer look at the cervix. So, the doctor will probably also swab the cervix to collect vaginal fluid or to see how easily it bleeds. So, cervicitis treatment. So, you may not need treatment for cervicitis prostatitis. So if a sexually transmitted infection is not the cause, if an infection is suspected. So the main goal of treatment is to eliminate the infection and prevent it from spreading to the uterus and fallopian tube. Or if you are pregnant to your baby, so depending on what organism is causing the infection, your doctor may prescribe antibiotics, antifungal medication, and last is the antiviral medication.
So, Assalamualaikum and good day. My topic is the prostate. So first, the prostate is a walnut-sized gland located between the bladder and the penis. So the prostate is just in front of the rectum. The ureter runs through the center of the prostate, from the bladder to the penis, letting urine flow out of the body. The prostate secretes fluid that nourishes and protects sperm. During ejaculation, the prostate squeezes this fluid into the urethra and it's expelled with sperm as semen. So there are three conditions in prostate, which is prostatitis, enlarged prostate, and the prostate cancer. So first, what is the prostatitis? So it refers to 4 different conditions that affect the prostate gland. 2 types of prostatitis are linked to UTI, the urinary tract infections. Other types are not. Men with prostatitis may have infection, inflammation, or pain. So adult men of any age can get this prostatitis. Many men who are told they have this prostatitis are misdiagnosed and actually have different condition. There's a lot of outdated information about this prostatitis. So, move on. Types of prostatitis. First is acute bacterial prostatitis. So, it is a urinary tract infection causes in the prostate gland. The symptoms are fever and chills. A person can also experience painful and frequent urination or nahihirapan siyang mag-ihi. So, acute bacterial prostatitis requires immediate medical treatment. The second one is the chronic bacterial prostatitis. This is when the bacteria become trapped in the prostate gland, causing recurrent UTIs that are difficult to treat. So, the other one is also chronic pain syndrome, or the CPPS. This is the most common prostatitis type. This is the prostate gland inflammation occurs in 1 out of 3 men. As the name implies, this type causes chronic pain in the pelvis, perineum, and the area between the scrotum, rectum, and genitals. The last one is the asymptomatic inflammatory prostatitis. This condition causes prostate gland inflammation, but no symptoms. You may learn you have this condition after getting tests to find out what is the cause of this and the other problems. For example, a semen analysis for infertility may detect asymptomatic inflammatory prostatitis. So the prostatitis sign and symptoms depend on the cause. This may include the pain or burning sensation when urinating, difficulty urinating such as dribbling or hesitant urination, frequent urination, yung parang naiihi ka palagi, especially at night, urgent need to urinate, cloudy urine, blood in the urine, pain in the abdomen, groin or lower back, pain in the area between the scrotum and the rectum, pain or discomfort of the penis or testicles, and painful ejaculation, and also a flu-like symptoms with bacterial prostatitis. Complication for prostatitis can include bacterial infection of the blood, inflammation of the cold tube attached to the back of the testicle, pus-filled cavity in the prostate, semen abnormalities, and infertility, which cannot cure with chronic prostatitis. So, diagnosis for this infection is involves urine test. Your doctor might have a sample of your urine. Kukunin nila yung sample of your urine, then i-analyze nila yon to look for signs and of infection na meron doon sa ihi or sa urine ng patient. So, the doctor may also send a sample of urine to the lab to determine if you have an infection. So, the other one is also is blood test. The doctor might examine samples of your blood for signs and infections of prostate problems. Prostatic massage. Your doctor might massage your prostate area so that to test the secretion. Imaging test. The doctor might order the CT scan of your urinary tract and prostate to provide more details, informations, to visualize the image, kumbaga. Prostatitis treatments, nagdidepend yun siya sa underlying causes. So, the treatment may include antibiotics. This is the most commonly prescribed treatment for prostatitis. If you have severe symptoms, you might need intravenous IV antibiotics. The other one is also alpha blockers. These medicines, kumbaga, nag-help siya to relax the bladder neck and muscle fibers where your prostate just joins your bladder. This treatment might ease the symptoms such as nakakatulong siya mag-relieve ng pain. Especially mag-relieve ng pain kapag during urination. So, the other one is also anti-inflammatory agents and non-steroidal anti-inflammatory drugs might also used to make a person that having this kind of infection to make him or her comfortable. So there is also a lifestyle and home remedies you might do if for this infection. You might have to drink a lot or a plenty of fluids. A caffeine-free beverages. This will help you, especially if you drink a lot of water. This will cause you to urinate more and will help flush the bacteria that is in your bladder. So the other conditions of prostate is enlarged prostate. An enlarged prostate means the gland has grown bigger. Kumbaga, yung prostate ng isang tao is lumalaki. A signs of abnormalities. So, prostate enlargement happen to almost all men as they get older. An enlarged prostate is often called benign prostatic hyperplasia or BPH. This is an enlarged prostate is a benign which is not cancerous, and it does not raise a person's risk for prostate cancer. The cause of this prostate enlargement is unknown. Some facts about prostate enlargement is that the likelihood of developing an enlarged prostate increase with age. BPH is so common that it has been said all men will have enlarged prostate if they live long enough. Kumbaga, kapag matanda na daw yung tao, na there is a possibility, especially sa mga lalaki, they will develop an enlarged prostate. A small amount of prostate enlargement is present in many men over 40 to men over age 40. So, move on tayo sa sign and symptoms. So, sign and symptoms of enlarged prostate can include a weak flow of urinary stream, a feeling of incomplete bladder emptying, difficulty start of urination. So, sa ihi talaga siya nagpo-focus. Nahihirapan mag-ihi yung isang tao. Frequent urination, daran siya ihi. Urgency to urinate, kumbaga pag-ubos niya, pagkatapos niyang umihi, and then a minutes later or ganyan, or seconds to minutes later, urgency to urinate na naman. So, getting up frequently at night to urinate. Yes, a urinary stream that start and stop straining to urinate. Continue dribbling of urine and return to urinate again minutes after finishing. So, yun yung mga signs and symptoms. So, kapag yung bladder ng isang tao ay hindi talaga siya completely nag-empty, there is a high risk for developing urinary tract infection. So, another serious can also develop over time, including bladder stones, blood in the urine, or incontinence, and acute urinary retention. So, BPH diagnosis is that the first check usually the doctor will do or begin is by doing physical exam and asking you about your medical history. The physical exam includes a rectal examination that allow the doctor to estimate the size of the shape of your prostate. So, the other tests can include urinalysis. Okay, your urine is checked for blood, if there's a presence of blood in your urine. So, urodynamic test. If your bladder is filled with liquid via catheter, kumbaga, to test or to measure the bladder's pressure during urination. So, yung prostate-specific antigen or PSA test, this is a test that checks for cancer of the prostate. A blood test to check for cancer of the prostate. So, also, post-void residual. This test the amount of your urine left in your bladder after urination. So, and cystoscopy. This is the examination of your urethra and bladder with a tiny lighted scope that's inserted into your urethra. For BPH treatment, so it is begin with the self-care and lifestyle adjustment. If symptoms don't subside, medication or surgery can be recommended in this treatment. So, your age, and so it is better for you to let your doctor know if you have any sign and symptoms for this infection. So, the other conditions also in prostate is the prostate cancer. So the prostate cancer is a cancer that is form of that develops in the prostate. So causes of this prostate cancer is unknown. It is unknown, or it doesn't know how does this prostate cancer start. But autopsy studies show that it is very common in 50 age men. And out of 10 autopsy cancer found are small with tumors that are not harmful. So prostate cancer is a malignant growth. There is two types of prostate cancer, the benign and the malignant. But this prostate cancer is, the benign one is yung BPH, enlarged prostate. So enlargement of prostate. So this one is a malignant growth, prostate cancer. So this is a this is a threat to life. This prostate cancer can spread to the nearby organs such as the bladder and the urethra, and can spread to other parts of the body once kapag yung infection na yun is dumadaloy na siya sa dugo. So it can spread to the lymph nodes and or bones. So often can be removed but sometimes grow back. Pwede siyang i-perform ng surgery, alisin yung tumor na meron doon, but there is a possibility of chance na babalik yung cancer na yon. So prostate cancer cells can spread by breaking away from a prostate tumor. They can travel through the blood vessel or lymph nodes to reach the to reach the other parts of the body. Kumbaga, they are spreading. They travel to the blood vessels and then or lymph nodes, and then after that they will invade other parts of the body. And then after spreading that, the cancer cells may attach. So kumbaga, kung saan na napupunta yung mga cancer cell na yon, doon na sila magsastay. They will attach to that tissues and then grow and then form to new tumors, and then causing damage to the organs where they land, kung saan baka sila napadpad. So when prostate cancer spreads from its original place to another part of the body, the new tumor has the same kind of abnormal cells. Whether, for example, if yung kumbaga, for example, kapag yung prostate cancer na yon spreads to, or kumbaga napunta siya doon sa bones, ang tawag sa cancer cell na yon is prostate cancer cell, kasi that prostate cancer cells is original, kumbaga doon siya nanggaling sa prostate. Kaya yung tawag doon, kapag napunta siya doon sa bone, is prostate cancer cells yung tawag doon. The disease, kumbaga yung sakit na matatawag sa kanya is metastatic prostate cancer, not bone cancer. So for that reason, the treatment would be considered is prostate cancer. It will treated, kumbaga, prostate cancer cell, kumbaga, it is treated as what treatment for prostate cancer. So the signs and symptoms for this prostate cancer in early stage, it has no symptoms, but The prostate cancer can be dull pain in the lower pelvic area, frequent urinating, same as sa mga condition na na-mention ko kanina, frequent urinating, trouble urinating, nahihirapan mag-ihi, kapag naihi man, kapag umiihi siya, masakit, and kumbaga hindi masyadong malakas yung flow ng urine niya. So, blood in the urine, there is a presence of blood. So, painful ejaculation, pain in the lower back, hips, or upper thigh. So, loss of appetite. This is also a sign and symptoms. Loss of weight and the bone pain. So, what are the risk factors for prostate cancer? So, first is age. Age, this is a high risk of as men age, kumbaga, this is a very common in men. As a man age, kumbaga, there is a chance for them to develop this prostate cancer. So, a family history, kapag yung family mo is may past histories ng prostate cancer or prostate cancer, this prostate cancer can be also a heredity. Kumbaga, makukuha mo siya kapag merong isa sa pamilya mo is nagkaroon ng prostate cancer. So, smoking. So, isa rin sa mga risk factors is smoking because a heavy smoke is also linked to a higher risk of dying from prostate cancer. Diet also. So, kapag yung eating habits mo is hindi siya ganun ka-healthy, this is a high a risk factors to develop a prostate cancer. Especially kapag kapag malakas ka mag-consume ng calories, animal fats, and sugar, tapos hindi ka naman ganun gaano ka lakas mag-consume ng mga good nutrients katulad ng mga fruits and vegetables na gano'n. It can affect your prostate also. Also, a lack of exercise. Then, yung pagiging obesity ng isang tao, overweight. It is known to increase a man's risk of dying from prostate cancer. Ma-prevent yung prostate cancer if you are willingly to self-care your health. You are heart healthy, you are keeping your prostate healthy, you're eating right, you exercise, you monitor your weight, and you are not smoking. This can be a good way to prevent prostate or to avoid having a prostate cancer. So, diagnosis for prostate cancer is screening. This means testing for disease even if you have no symptoms. So, this prostate-specific antigen or yung blood test and digital rectal examination are two tests to use to screen for prostate cancer. Both of them are used to detect the cancer early. But these tests are not perfect. Abnormal results with either test may be due to benign prostatic enlargement or infection rather than cancer. So, meron din also there is also main types of the two main types of screening is yung PSA, yung blood test. So they will obtain your blood and then screen it for prostate cancer. They will measure the level of the PSA in the blood, and also the test can be done in the lab, hospital, or healthcare provider. So, after that, meron ding tinatawag ng digital rectal examination. This to find, this is a way to find your prostate problems. For this exam, the healthcare will put the healthcare provider will put a lubricated glove finger into the rectum. They will insert that, and then so either the man will bend over or lies carried at his side on the table. During this test, the doctor feels for abdominal shape or yung thickness ng prostate. It is the digital rectal examination is very safe, easy to do, but the digital rectal examination itself cannot detect early cancer. It should be done with a PCA test. So that's all for this topic.